Hi everyone, my name is Brandon Gieler, and I'm a second-year medical student here at Touro University of Nevada, and together with Charles Herndon, another second-year medical student, and a host of great faculty, we were able to take on a project describing a new method to investigate extracellular vesicles that are circulating within human bodies. These EVs are basically packages of material that originate from almost every area in the body, and it's just circulating in our blood. This is especially useful in the diagnosis and treatment of disease. Typically, to acquire samples from a patient, for example the brain, you would need to take a tissue biopsy, which has many risks involved. We propose studying EVs that are already present in the blood. It's much less invasive and has a lot less risk of harm to our patients. Now, what we've done differently here in our study is we're isolating EVs from human plasma, and we're permeabilizing them, meaning we're punching little holes in them. And then we're inserting these antibodies with little fluorescent markers on them to identify what's inside of these packages. The good thing about punching holes in them and not just breaking them down is that we're also able to use the same antibodies to tag the outside of these EVs. Then we can determine exactly where they're coming from. With this new method, we are now looking at neuroinflammation and how that affects long-haul COVID patients. What we have found is an increase in EVs released from the brain that not only have the coronavirus spike protein, but also has these HER-V proteins, which are human endogenous retroviral proteins. These findings suggest a role of HER-V proteins in microglial activation and neuroinflammation in long-haul COVID patients. Thank you, and please join us on Research Day 2022 for more information.